Good evening everyone. Welcome back to yet another episode of BMC Global Live Al-Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. Good health is not a destination, it's a journey. In this talk show Health World, we have expert doctors from various fields providing valuable information and assistance in your journey towards good health. Today, we have with us Dr. Pankaj Joshi, specialist orthopedic surgeon from Al-Hilal Hospital, Moharak. Dr. Joshi has over 15 years of experience in orthopedics and his area of expertise is spine disorder treatment, complex fractural procedures and lower back pain management. Today, the topic of discussion is gout. Thank you for joining us, doctor. Last week, you gave us some valuable information about lower back pain management, much appreciated. So this episode we will talk about gout. That is also a very common problem seen amongst people today.
Yes, big topic.
Yes, so could you please tell us what exactly is gout?
The gout is a normal term but scientific term called as hyperuricemia, where the patient have the acute pain in the joints and can't bear the pain with painkillers also. So such kind of metabolic disorder we say, and gout is like hereditary, as this is in the familial diseases, and this patient always have the recurrent attack of the gout, and it's called as hyperuricemia, and it's not like simple joint pain. It is linked with some metabolic disorder, which is family related, like hereditary things.
So you mentioned about pain being one of the characteristics of gout. Why is it so painful? Is there any particular reason behind that?
The hyperuricemia as a gout, it is formation of the crystals of the uric acid. Uric acid is the waste product from our kidney. It should pass in the urine. Because of some genetic defects in the clearance of uric acid crystals, they deposit in the kidney. And as we know, the tank, dirty tank, and after settlement the dirt goes on the ground and the fresh water on the top. Same thing, like these crystals form which are high specific gravity, and these crystals deposit in the joints, and these crystals make pain for us because they are more perception for the pain.
And what causes this exactly?
Crystals deposits, as I told, like a metabolic disorder, and when this crystal levels are more and more, uric acid level increases in our body, they affect on the joints basically, and they affect on the muscles also. The crystals which are blocking the joint movement, and one day patient says like, doctor, I have too much pain, I don't have this pain before and now suddenly pain. It is the uric acid increases, it increases the joint pain.
And is gout hereditary? Do we inherit the genes from our parents or
yes,
from our...
it is hereditary. Someone in the family member, mummy or papa, father or mother, they are suffering with this pain, and this is a genetically transposition in the genes of that kids, and especially they present in the second and the third decade of life, not in the children's. And as a genetic predisposition, it presentations sudden acute pain, and it has to be diagnosed.
Okay, so when you get into your 30s is when you normally develop symptoms of gout.
Yes.
Okay, and you mentioned about uric acid. Could you please explain what exactly is uric acid?
Uric acid is a byproduct in our kidney. It has to be like excreted from our urine normally, this normal principle. In the gout patient, hyperuricemia patient, these crystals not able to go outside the body. Urine will not absorb them. It is depositing in the kidney lobules, and it spread in the systemic circulation. And after spreading, this is like because of high specific gravity, they are depositing in the lower joints. Because of specific gravity, they settles in the knees, most common in the feet areas, in the calcaneal spur areas, and the 70–80% of people present with the foot pain or the heel pain or the knee pain. Upper limbs also they are presenting with very high levels of uric acid, but most commonly in the great toe area, then the heel areas, then knee areas.
Okay, so when you have high levels of uric acid, what does it indicate?
It indicate like the kidney functions are not regularized, and it is alarming sign. We have to immediately consult the orthopedic surgeon. These are two important things. I don't want to go in the details study and the lab testing for kidneys and many things, but these two signs very important. It is saying like body is telling yes, need to take the orthopedic consultations. Don't rely on the painkillers, and after consulting get clear the level of uric acids. Levels of uric acid, the lab ranges are different from the center to centers all over the world, but if the level is above the 80 to 90% level of uric acid, it means like they need to control the diet. 90 plus above the level of uric acid, they has to control with medicines, certain medicines, and the diet control. Diet is a very important thing.
So diet plays a very important role. So what are the food items that we should avoid, and what is it that we can have more of to control our uric acid levels?
Yes, diet is 95% problem solving concept in the uric acid as we see in our practice. High protein diet is the main chunk for the uric acid crystal formation. How? Number one thing is like tomatoes, they have the tyrosine kinase. They are more stimulate for the crystal formations. All kind of meat, chicken, beef, fish, egg yellow, red color masoor dal, strawberry, grapes. These are among all important high protein diet has to be stopped immediately after diagnosing the uric acid. I will repeat like tomatoes, red meat, chicken, like beef, fish, egg yellow, strawberry, grapes, and spinach also in the vegetarian.
The protein intake has to be kept under control. It has to be minimized.
I would say if you are diagnosed uric acid, you halt this thing, you stop this thing to make happy life. Otherwise, some people ask me like, can I take the little chicken or like fish? I says like if for example, few patient came with the uric acid normal today, and they eat the one tomato, and the next day came with uric acid like far high. So the sensitivity level of these high proteins are very high in case of uric acid, and the controlling is very difficult. Then again, we have to give the like large doses of the uric acid medicines available in the markets, but it can control with painkillers and the gout medicines.
So doctor, how do you treat an acute gout attack? What are the treatment options available?
Yeah, in acute management, we have the painkillers, anti-inflammatory tablet, local application of ice and the gel. Always in the acute attack pain, some people have the misconcept like putting the warm water, oil, massage. Yes, welcome for thoughts, but the scientific answer is ice fomentation, that area, and the painkiller gel application. In acute attack, when it says like terrible pain, so has to treat with painkillers. If you draw a curve and there is a spike for the curve, in the spike phase, when you have the pain of gout patient, only take the painkillers. Once pains disappear, then continue your gout medicines. It is not required always to take the gout medicines and the painkiller together. Suppose today patient have the gout patient diagnosed already and have the pain, so keep in mind your gout medicine has to be stopped, and you continue the painkiller tablet for remaining painful period. After pain is bit reduced, then continue your lauric tablet or uric acid tablets. If you take the gout medicines with painkillers, pain may flare up.
So pain management comes first. Once the pain subsides, then they can switch on to the medicines for
the gout, yes.
High uric acid. And what is the duration of this treatment of medicines and all that? Is it a long-term treatment?
Acute attack will settle within 24 to 48 hours. Natural history says like if you don't take anything, if you don't take anything, within 48 hours pain disappears. But nowadays everybody is pain sensitive, so they treat okay. But for the like gout management, long-term special medicines for the gout plus diet control. We observe like patient, nobody like to take tablet daily. I say my patient like you take diet control as a seriously, you no need to take the tablets. It is vice versa. You take the strictly diet control in your routine life, you no need to take the gout tablet. some people not listen, they have like lifestyle with the high protein diet. So they has to screen with liver functions, kidney functions regularly. And very important thing I want to tell, like long term study says like any person have the gout is not controlled, they'll end up in the kidney disorders long time, kidney stones and kidney failure even. Out of like if you visit any dialysis center, we found like 50 to 60% of people of gout, they suffered with kidney failures.
So gout is something that needs to be taken seriously, and you
seriously
cannot ignore it for a long
yeah,
period of time.
second, third decade is the time where alert signs are there, so we can take care and diagnose properly and control with diet and medicines, so no harm for the body.
And does it recur? Do patients who normally have gout, maybe they have one attack of gout, are they more prone to getting more attacks in the future?
Ideally, uncontrolled diet is the like answer for the recurrent attack. If you take the medicine properly and the diet control sincerely, there is no recurrence attack of the gout. Some people ignore the checking level 6 monthly, 1 yearly. So we found sudden recurrence is there. At that time, controlling the levels will be bit difficult, need to take the medicines long time. If you sincerely follow the high protein diet and every 6 monthly checking your uric acid level, accordingly take the medications, recurrence hardly any.
Okay, and for severe acute gout patients, is it mandatory to take medicines lifelong?
Yes.
To keep it, to prevent it or to keep it under control?
For the acute cases, you have to diagnose for the uric acid level, what is the level, what is the grade. If the level is very high, it has to take the, once you diagnose for the gout, at least for further 6 months to 1 year, has to take the medicines. There are chances, many more chances, 60 to 70% recur the pain if you not take the medicine for 6 months to 1 year. So we suggest the patient you at least continue for 6 months and observe yourself how much recurrence is there, and the level is controlling, since sometimes we can discontinue the gout medicines and the assurance for the high proteins.
Doctor, can you please throw light on the other different kind of arthritis other than gout arthritis?
Yes, gout is not only one scenario for the arthritis. The many more arthritis in the blood, like rheumatoid arthritis, which is also family inheritance is there, inheritance. Second thing, like genetic disorders are there. Psoriasis is there, like some people have the skin psoriasis, they also have the arthritis. Rheumatoid arthritis have different presentations. Gout have the different presentation. Psoriasis is there. Autoimmune disorders are like SLE, we say, like some people have the butterfly rashes on the face. They are more prone for arthritis. But they has to be diagnosed on the blood test. Has to consult a doctor, orthopedic surgeon and the rheumatologist for that, and get know plus what kind of arthritis I have. Only taking painkillers, I have the arthritis is not the mean. Has to consult rheumatoid arthritis, other kind of autoimmune disorders. There are many much more blood tests. I don't know to go in that. But one link between the all arthritis is there. Your exercise, your diet, high protein diet has to be controlled, and drink water, hydrate yourself. Hydration therapy is very important in arthritis.
So adequate intake of water, 2 to 3 liters water a day.
Adult, 30 plus adult, at least take 5 liter water in a day. You mark 5 liter. It means your joint cartilage will be healthy.
So is that effective in pain management also? Will it help to reduce the pain?
Water yes, intake? Water therapy is also the like a pain treatment, pain management, but at certain limit. We have to treat first ice and the fermentation, ice fermentation and the gel fermentation. See, ice will block the pain receptors at that painful area, so there will be painless joint, plus swelling will reduce with application of topical local applications of gel. That not the story only, has to consult an orthopedic surgeon, get diagnosed. Only taking painkillers like carry on the life, no. Has to be somewhere, think and consult, get diagnosed and get assured about your arthritis.
Okay, and unlike lower back pain, because normally whenever we experience any kind of pain, we have a tendency to go for hot fermentation. But for gout, I think
Ice, yes.
viewers, you have to keep in mind that
Yes.
it's
Ice
cold
fermentation.
fermentation.
In the back area, basically the muscle spasm, hot water always there. In the joint, upper limb, lower limb, ice is always good therapy. Some hint like, apart from this gout discussion, I want to tell like sport persons traumatized in the football activities or on the ground or working anywhere. Forget about the painkillers. They don't have painkillers there. What are 4 things very important? Is like rest, ice fermentation, compression that area, and the limb elevation. Suppose any football man got injury on the ankle joint or injury on the wrist. So rice therapy, rest, ice, compression and elevation of that part will solve the problem for the patient 50%. This is rice therapy very important for the joint pain management in gout cases plus any injury cases also.
Any last words on gout management?
Gout means not like a danger disease. A lot of people have this thing. The treatment is very easy. Get assured with orthopedic surgeons. Get confirm your levels of uric acid. Get clearance from kidney and the liver. And yes, high protein diet has to be restricted in the gout cases. I think these 4 important things, if you get confirmed yourself, I don't feel like more tension for the gout.
Thank you so much, doctor, for explaining to us in detail about gout. Viewers, if you experience any symptoms of gout, please don't delay any further. Feel free to visit Dr. Pankaj Joshi in Al-Hilal Hospital, Muharraq. For many more informative and valuable episodes like this, don't forget to tune in to BMC Global Life Al-Hilal Health World, Nothing But Lifestyle. Nourish your body, your mind and your soul. The groundwork of happiness is good health. Wishing you all lots of happiness and good health always. Stay smiling, stay happy. This is Anupama signing off till we meet again next time. Good night.